Welcome to another short from the Veterinary Medicine Digest. Today we are focusing on hyperfibrinolysis, a crucial topic in critical care involving the premature breakdown of blood clots, often resulting in clinically relevant hemorrhage in cats and dogs. This serious bleeding disorder stems from a dysregulation of the finely tuned system that balances clot formation and clot dissolution. Diagnosing hyperfibrinolysis relies heavily on modern viscoelastic testing methods, such as thromboelastography and rotational thromboelastometry, because these technologies offer a global, dynamic assessment of the coagulation process. These methods are considered superior to routine coagulation tests, like measuring D-dimers or fibrin degradation products, which often lack the necessary specificity to guide acute treatment. Hyperfibrinolysis is associated with several complex acquired conditions. Liver disease stands out as a major risk factor in cats and dogs, because the liver is responsible for synthesizing and clearing most proteins involved in hemostasis. In cases of severe liver impairment, hypocoagulability and hyperfibrinolysis frequently emerge. We also recognize cavitary effusions, including ascites and pleural fluid, as important risk factors. The cells lining these cavities secrete profibrinolytic agents, and the systemic reabsorption of this fluid is thought to induce systemic hyperfibrinolysis, often classified as primary hyperfibrinolysis. This is particularly relevant, as the presence of heart disease may, surprisingly, be associated with a reduced likelihood of hyperfibrinolysis in cats, possibly reflecting a protective effect against thrombosis from effusion-related fibrinolytic activity. Another key cause is acute traumatic coagulopathy, a complex syndrome following severe trauma and shock. This condition often involves hypocoagulability and excessive clot lysis driven by the massive release of tissue plasminogen activator from activated endothelium. Furthermore, parasitic infections have been identified as triggers. Dogs infected with Angiostrongylus vasorum frequently present with hyperfibrinolysis and severe deficiency of fibrinogen, a combination treated with plasma transfusion and antifibrinolytic drugs. Interestingly, a recent case documented transient acquired hyperfibrinolysis in a dog with Strongyloides stercoralis infection that resolved following antiparasitic treatment. Neoplasia, such as metastatic nasal adenocarcinoma in a dog, can also drive a severe secondary hyperfibrinolysis syndrome, often linked to chronic disseminated intravascular coagulation. In certain breeds, such as greyhounds, enhanced fibrinolysis is the suspected cause of delayed hemorrhage following surgery. The primary treatment for confirmed hyperfibrinolysis is the use of antifibrinolytic agents, specifically lysine analogs like tranexamic acid, which inhibit the dissolution of the clot. Clinical trials confirm that administration of tranexamic acid successfully suppresses this excessive clot lysis in dogs with hemorrhagic shock, although its effect on survival rates requires additional large-scale investigation. Thank you for listening. The link for the full podcast is below. Remember to like, share and subscribe if you enjoy this kind of material. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.